Positioning and turning clients. In home care, frequent positioning and turning are essential for maintaining a client's comfort, circulation, respiratory function, and skin integrity, especially for clients with limited mobility or who are bedridden. This lesson will teach you how to safely and properly position and turn clients to support health outcomes and prevent complications such as contractures, respiratory issues, and pressure injuries. As a home health aide, HHA, you play a crucial role in ensuring that these tasks are done consistently and correctly. Understanding the importance of proper positioning. Why it matters. Promotes good circulation and reduces risk of blood clots. Supports lung expansion and easier breathing. Prevents muscle stiffness and joint contractures. Reduces risk of pressure injuries, bed sores. Enhances digestive and urinary function. Frequency of turning. For clients who are bedridden or immobile, turn them at least every 2 hours. Turning schedules may vary based on individual care plans. Common client positions and their purposes. Supine position, on back, used for resting and sleeping. Legs extended, arms at sides or slightly elevated. Use pillows under head, arms, and calves to reduce pressure. Lateral position, side lying, used for turning and pressure relief on the back. Support pillows placed under head, upper arm, back, and between knees. Prone position, on stomach. Less common, may be used for certain respiratory needs. Place pillows under abdomen, shins, and head if needed. Fowler's position, semi-sitting, used for eating, breathing, or watching TV. High Fowlers, 60, 90 degrees, or semi-Fowlers, 30-45 degrees. Support back and knees with pillows if needed. Sims position, semi-prone, used for enemas, rectal exams, or unconscious clients. Lying on left side with right knee bent, supported by pillows. How to safely turn a client in bed. Preparation. Wash hands and put on gloves if necessary. Explain the procedure to the client. Ensure the bed is locked and at waist level. Position the bed flat unless contraindicated. Step by step. Turning a client side to side. Stand on the side the client will be turned toward. Gently move the client's head, shoulders, hips, and legs toward you as one unit, log rolling if necessary. Cross the client's arm and leg on the far side over their body. Roll the client toward you using the draw sheet or by gently guiding their hip and shoulder. Support with pillows behind the back, under the top arm, and between the knees ankles. Tip. Never pull on the client's arms or legs. Use proper body mechanics and always bend your knees. Safety and comfort considerations. Check for lines, tubes, or catheters before moving the client. Always communicate before and during the turn. Ensure side rails are up on the side the client is turning toward, if used. Use a draw sheet to reduce friction and protect skin. Assess for redness, swelling, or discomfort after turning. Ensure the client is comfortable and aligned before leaving. Documentation and communication. After each positioning or turning session, document time of repositioning, position placed in, any skin changes or complaints of pain. Report any abnormalities to the supervising nurse. Clear documentation helps with tracking pressure relief routines and supports care continuity. This lesson covered the importance of safe, compassionate positioning and turning. Positioning and turning are acts of clinical care and compassion. Frequent, safe repositioning prevents serious complications, supports client comfort, dignity, and quality of life. Mastering this skill ensures essential physical support in home care. Proper repositioning protects health, preserves dignity, and enhances quality of care.